Hi, so as part of Mental Health Awareness Week, I just wanted to jump on and reinforce the importance of physical activity and exercise for people that do have conditions such as stress, anxiety and depression. So as part of Mental Health Awareness Week, there's been a lot of education, a lot of training, a lot of initiatives, and it's fantastic to really make people more aware about conditions, make people that have mental health conditions such as stress, anxiety, depression and a whole range of others realise that it's okay to talk about it. It's okay to do things that they thought they couldn't do. And it's a great week really for trying to really highlight something that should always be a priority for both, say, fitness professionals in our case, and for other people in the ream of helping, so like counsellors, cognitive behavioural therapists, all of those things. So we're all trying to do our bit to try and help promote the awareness of mental health and people talking about it. So on that note, I just want to really quickly run through some of the benefits that can be achieved with regular physical activity and exercise for mental health. Now, a while ago, and I'm sure there's been more recent studies that have also come across this and found these results to be so. Sorry, bear with me, my phone's got notifications. So a while ago, a study called Move On Up looked at exercise in conjunction with and as an alternative to medication, psychological therapies, so for example CBT, and also just doing nothing. So there was like a comparison between all of these different interventions for people that live with depression. And they found after a fairly long period of time throughout this study that, of course, as we know as fitness professionals, exercise actually came out best out of all of the interventions for a whole range of reasons. So some of those included the fact that there wasn't just one way to do exercise. There's so many different forms of exercise. You have your walking, your swimming, you have group exercise, you have gym exercise, dancing. There's just so many options out there that it's a much more versatile form of an intervention to help people manage their condition. So that was one of the first things that came out, and it could really appeal to people and what they enjoy doing. Then it came back to that it was actually more social. So by whether it's working one-on-one with someone, whether it's actually going out yourself and just meeting people as you go for a walk, or whether it's actually attending a class, being more social helps people with mental health conditions. So as such, that was a benefit. And those first two benefits definitely can't be achieved through antidepressant medication, for example. So that's why that first of all came above